Hi, welcome to Mind.ease, where today we will be discussing depression. According to the National Institute of Mental Health, or the NIMH, in 2020, at least 21 million Americans over the age of 18 experienced at least one episode of MDD, or major depressive disorder. It was also found that MDD is more prevalent amongst females at a percentage of 10.5% compared to that of in males, which was 6.25%. Today we have Dr. Jacob Palathinkal, who will be discussing what exactly depression is, what causes it, its symptoms, and any available therapies or modalities. So Dr. Palathinkal, can you explain to us what exactly depression is versus what it is not, and what causes it?
Depression is not brought on by one single cause or reason. Depression is brought on caused by multiple factors, including faulty brain regulation and also by overwhelming responses to life events. Depression is a highly heritable illness, meaning that there is the genetic vulnerability. There are research that shows that children of parents who have depression, there is 50 to 60% or higher predisposition of offsprings developing depression. In the community or even in the mental health field, individuals talk about depression being a factor of too little or too much of chemical changes. Once again, it's not one single factor, rather, it's brought on by multiple factors. I also need to add that depression is the number one cause for work-related disability.
Are grief and depression the same? And at what point in the grieving process should one seek help?
Grief is a normal response to losing a loved one, and the length of this grieving process may vary. They may feel as they want to be with the loved one who they lost dearly. Sense of emptiness. If it lingers for more than 6 months, according to the Diagnostic Statistic Manual, if it lasts more than 6 months, it becomes known as persistent complex bereavement disorder, where the individual is also thinking about having negative thoughts of suicidality, this preoccupation of wanting to be with the deceased one. Versus depression is more of sense of chronic emptiness and all the other symptoms of depression where they feel a sense of guilt, worthlessness, hopelessness, anhedonia, meaning that they feel not enjoying their life, a sense of emptiness. So it's very important to identify and differentiate normal grieving process versus persistent complex bereavement versus depressive disorder.
How is depression diagnosed, and who are the professionals able to confirm the diagnosis?
Depression is generally first seen by the primary physician, who may see the symptoms of depression but may feel unfit to treat the depression. It's diagnosed by mainly mental health providers such as psychiatrists, psychologists, social workers, licensed mental health clinicians, and nurse practitioners. These are the individuals who are able to diagnose and screen for depressive disorder. And depression is diagnosed by presenting symptoms, which, as I mentioned earlier, are symptoms of feeling emptiness, anhedonia, chronic sadness, changes in appetite and sleep pattern. And there are various disorders that needs to be also differentiated from depressive disorder, because individuals can be presenting with depressive phase of the bipolar disorder, and that can mimic depressive disorder. So it's very important to obtain history from the patient. How long has this depressive symptoms been going on? What are other comorbid symptoms that the individual is struggling with? Some of the symptoms that they may be presenting with symptoms of depression, but they may be really part of other disorders. Some of the common medical disorders are vitamin D deficiency, fibromyalgia, chronic fatigue syndrome, hypercalcemia, and other such as hypothyroidism. So it's very important to have a medical workup when the diagnosis is not so clear. And some of the other mental health disorders that can mimic depressive symptoms are, once again, bipolar disorder, attention deficit hyperactivity disorder, schizoaffective disorder, premenstrual dysphoric disorder, and even anxiety, which is highly comorbid with depressive disorder.
What are the general symptoms of depression someone should be looking out for either in themselves or a loved one before seeking help?
Some of the common symptoms of depression include sadness, lack of enjoyment in life, feeling guilty, worthlessness, emptiness, difficulty falling asleep or sleeping too much, very much a change in their appetite, either eating too much or eating little, low level of energy, thoughts of passive suicidal thoughts. These are common symptoms in adults who are presenting with depressive symptoms. A big variation in depressive symptoms in the child and adolescent population is that they present more with irritability and restlessness compared to the adult population. So it's very important to differentiate that child and adolescent would not be always presenting with sadness and hopelessness, that they may be very much present with irritability and anger outburst.
How is depression treated and what modalities are available?
There are multiple modalities available for treating depressive disorder. Generally speaking, individuals who are struggling with depression initially seek the help of a therapist. The therapist may be trained in different modalities of talk therapy. It could be cognitive behavior therapy, also known as CBT, or the therapist could be trained in psychodynamic focus therapy, where the therapist tries to find out what are the ingrained or rooted issues that are patients presenting with depressive symptoms. The other modalities, medication management, medications such as selective serotonin reuptake inhibitor or SSRI, or serotonin norepinephrine reuptake inhibitor or SNRI. These are two classifications of medications that are available in treating depressive symptoms. Research shows that individuals who are in talk therapy alone, there is about 50% improvement in their depressive symptoms, versus individuals who are on medication shows slight more rate of improvement. Individuals receiving both talk therapy and medication therapy has a better outcome versus one alone. One of the other common questions that I receive is that how long should my loved ones or myself be in treatment for? The rule of thumb is that depending on how long these individuals have been struggling with the symptoms, we would say medication-wise, it's generally up to 12 months. Now, we would suggest that an individual continue talk therapy even after tapering off medication. Now, if the symptoms do come back or there's rebound symptoms of depression, medication should be continued under the supervision of a medical professional. CBT, or cognitive behavior therapy, is generally a short-term style of talk therapy, versus psychodynamic or psychoanalytic treatment are much more longer in duration and in terms of sessions per week. In CBT, an individual is taught to cope with the stressors by reframing their thought, by changing the body response, versus psychodynamic or psychoanalytical, where individual is trying to understand the deeply rooted issues, whether it's from childhood or even from adulthood, understanding what is causing these symptoms to reoccur. Some of the techniques used in psychodynamic or psychoanalysis is free association, while talking to the therapist without really thinking through what to say next, or analyzing their dreams, and also understanding what is deeply rooted. Many times there's a technique called transference or countertransference, where techniques you feel a certain way towards the therapist, where the individual or the patient may feel the therapist to be a maternal figure or a paternal figure, and you place your stressors onto them. And this can be productive at times. Psychodynamics, it takes much longer than CBT. And some of the common techniques used in psychodynamic focus therapy is free association, understanding one's dreams and nightmares and analyzing the same, and sort of rewriting their life story. Individuals who have traumas from childhood tend to do better with psychodynamic focused therapy versus CBT from my experience. Depression is a very treatable illness. You should seek help and not be ashamed of seeking treatment and enjoy your life.
Thank you for joining us today on Mind at Ease. If you have any questions, comments, or concerns, please feel free to leave them down below in the comment section, and we'll be sure to address them in future videos. Thank you.